Good evening, everyone. My name's Joanne Wilcox. I'm Programme Lead for Nursing. I'm going to talk to you today about the Nursing with Leadership course that we hold at Leicester University, University of Leicester. We now are very, very proud to have released single and dual registration courses. So my presentation this evening, is to cover both of those those arms of those courses. So I will try and cover both of those in my presentation. So welcome to you all. So why study nursing at Leicester? Our course is the only nursing course in the UK with the leadership strand integrated throughout. We are the only nursing course in the whole of the UK that when you graduate, when you get through the 4 years of our course, you will come out not only, if you decide to take the dual registrant route, you will come out as a dual registrant, which means you can go on the Nursing and Midwifery Council as a registrant in either adult and mental health nursing or child and mental health nursing. So what does that mean? That means that you could practice in a child field of nursing, you could practice in a mental health field of nursing, or an adult field of nursing. And that's really important because that opens up your employability prospects. You may well use both of those qualifications where you end up working as a qualified nurse is places like accident and emergency, a GP practice nurse, an advanced nurse practitioner, areas where nurses will come across patients that have physical and mental health needs. That is where the dual registration really comes into play and is so important, and it is something that our patient population needs. So we recognise that patients do have both physical and mental health needs. So the dual registration from an employability perspective is absolutely fabulous. It opens up lots and lots of doors for you, but also you will come out with an MSci. Okay, so it's a 4-year programme, so it's not a 3-year undergraduate pre-registration nursing programme, it's a 4-year programme, which means that extra year compared to other undergraduate pre-registration BSc programmes means you come out with a master's, okay, a master's in science of nursing. You will also have a leadership qualification. Now our leadership element is accredited through Leicester Business School. It is a theme that spirals up throughout the programme. So you start learning about leadership, your own leadership traits, how you recognise yourself as a leader and how you develop your leadership skills in year 1. Year 2, you will look at how leaders work together, how teams work together. Year 3, you'll look at leading a healthcare service. So you may from your practice experience, come up with ideas on how you could lead change as a practitioner. And then year 4, you start to pull all those themes together. So you start to look at leadership in practice, service change, and what good, effective, quality leadership actually means. So we're really very proud that this makes this course very unique. So, as I've just pointed out there, you'll also develop your skills to be a nurse and a leader of the future. So throughout your programme, you will go through a spiralling up of proficiencies. These proficiencies are recognised by the Nursing and Midwifery Council. They are required for you to be a registrant at the end of it. So you will not only experience those skills and develop those skills with us whilst you're learning on campus at university, you will also learn those in practice, and they will be witnessed and signed off by your practice mentors. So it's very much a spiralling up of your own proficiency throughout the 4 years. So our courses, as I've touched on at the beginning, we have 2 dual registration courses. So one is a mental health and adult nursing course. So you will graduate as a registered mental health and adult nurse. So that means that your registration is recorded on 2 parts of the Nursing and Midwifery Council register, okay? Or you could undertake the mental health and child nursing dual registration course, okay? So they encompass child physical health and adult and child mental health. It's really important that I point out, when you're doing the child course, you're also studying mental health nursing, and that is mental health nursing in children and in adults. So when you are placed on clinical placement, some of your clinical placements, if you're on the child and mental health programme, will be in adult mental health wards, because you are registering as a mental health nurse, but also as a child nurse. Okay. The single registration courses, we now have an MSci Nursing with Leadership adult nursing. So you register once on the Nursing and Midwifery Council register as an adult nurse. So what that means is that you won't not experience mental health placements, but you will predominantly, when you go out to working clinically, you will experience more physical health placements rather than mental health. And the other single registration course we have is the MSci Nursing with Leadership in Mental Health Nursing. So as the other adult nursing course does, you will experience predominantly mental health placements and learning about mental health nursing. But as I've said, we understand parity of esteem, that we can't divorce patients' physical and mental health conditions. So you may well experience some physical health placements, but predominantly your focus will be mental health. Okay, so you've got 4 programs really in effect to choose from. Occasionally, and we only allow this within the first year of the program, sometimes students maybe get through the first 6 months of the first year and decide they either want to transfer from dual registration to single registration or vice versa. We will allow that within the first 12 months. So I wouldn't say your decision can't be changed easily, but it is something we will consider within the first 12 months. So sometimes that happens, that people experience those strands and then they change their mind. Okay, so it's designed to train high quality nurses who can deliver expert care and pioneering leadership. That's our focus. We want you to be the future clinical nurse leaders. The course was first delivered, our first cohort was in 2018, so our course has been running for 4 years now. We're very proud that we've had our first graduates who are due to officially graduate in a month's time, but they've now finished the course and they are in their first posts. They're now working as nurses. So initially in 2018, it was a very small cohort, a very small intake of, we now have 3 graduates. And then in this year, we now have 56 students that have entered their first year of study. So we have grown and we are growing as we continue. The nurses that have graduated this year, the child branch nurse, she has gone to work in neonate, so special baby care unit, a very high level special baby care unit at the Leicester Royal Infirmary. Another nurse has undertaken a mental health post, and another nurse is working in the Children's Hospital. So, you know, they've really gone into some absolutely fantastic posts. So our course is very much a partnership between, when we design the course, it is very much inextricably linked between our practice partners, which are the University Hospitals of Leicester NHS Trust. So if you know anything about Leicester, we've got an acute care trust, which is shortened version UHL, that incorporates the Leicester Royal Infirmary, the Glenfield General Hospital and the Leicester General Hospital, and some peripheral satellite units as well. We also partner with Leicestershire Partnership Trust, a very large community-based trust that incorporates mental health care, learning disability care, community care as well. In fact, it's got over 1 million patient population, so it's a very, very large trust. And we now also place students at in Kettering, Northampton. So if we have any students that maybe live further afield and they want to be placed in placements a little bit further out, that's something we certainly can look at and accommodate. It's a 4-year pre-registration programme, and there's a 50-50 ratio across both fields during your degree. Okay, so 50% theory hours and 50% practice placement hours. And that is an NNC requirement. So we need to demonstrate that you've split your time whilst you're studying as a 50-50 ratio. So it is designed to train high quality nurses who can deliver expert care and pioneering leadership. We want you to be the nurses that question, the nurses that go out and identify opportunities for change, identify opportunities for service improvement. It is very much a partnership between the hospitals, as we've just said, and both pathways include interprofessional learning opportunities. We do learn throughout the programme with other professionals, because we recognise that when you work, when you graduate, when you go out into the clinical fields, you will work interprofessionally. So first year modules, very much, quite a few of the first year modules are shared with midwifery. So we learn together with midwifery. We do some shared learning with Leicester Medical School. We do some shared learning with physiotherapy, which is part of the School of Healthcare. And we also do some learning with radiography. Okay. The modules that we tend to share are leadership modules and evidence-based practice with midwifery. We also do some shared learning around health promotion and public health as well. So they tend to be the shared opportunities of learning. The course structure. I'll mainly touch on clinical placement first, because that's a bit that tends to get people excited. So how it works is over the 4 years, you will have 2 clinical placements per year. Okay, depending on what branch you enrol on, what course you undertake, you'll either do an adult or a child placement, or we tend to term those as physical health placement. And then you will do a mental health placement. So if you're on a dual registration programme, that's how it will work. Okay. If you're on a single registration programme, you'll do 2 placements per year in the same field. So 2 child, sorry, we don't do single reg child, but 2 adult or 2 mental health. The length of placement increases each year. So year 1, you'll do 6 weeks. So 2 placements at 6 weeks each. Year 2, you'll do 10 weeks twice. Year 3, you do 12 weeks, and year 4, you do 14 weeks. Within year 3 as well, we have an opportunity for you to do a 4-week elective placement. So that's your 3rd year. Students can choose where they want to go. The main focus is that they shadow, they spend some time shadowing people that are clinical leaders, so they understand clinical leadership. We have students at the minute that want to go to Sri Lanka, Cambodia, Tanzania. We've had students that have gone down to London and worked with the Nursing and Midwifery Council, the Royal College of Nursing. Research placements as well, working with research nurses. So there's lots and lots of opportunities. Really, it's up to you where you'd like to go and work. It's up to you to approach that area, that, you know, and then obviously we work with you in collaboration to secure that 4-week placement. Your clinical time is always supervised by registered nurses that are named as practice assessors. Okay, they are there to work with you. You also have practice mentors that will work alongside you and sign you off. Okay, placement areas include Leicester, Leicestershire and Rutland. We do cover quite a wide area, and like I said, we also use Kettering, Peterborough and Northampton. We are also looking at expanding our placement provision further, not only geographically but into other areas, other care providers as well, some voluntary and private providers. So the course structure, our modules include year 1, we have a Foundations of Nursing module, which spans the whole year. We also have what we call a bioscience module, which you will study the anatomy and physiology applied to nursing. Evidence-based practice is very much a spiral theme throughout the 4 years. So you will start off studying what is evidence, how is it clinically relevant, how is it applied clinically. Then in year 2, you will start to critique evidence. In year 3, you will start to think about your final piece of work, your dissertation, what you would like, some kind of research question that you would like to answer. And then in year 4, you complete your dissertation. So evidence-based practice is very much a theme throughout the 4 years, as is leadership as well. We also cover specialist care in mental health. So that could be long-term chronic mental health conditions, things like dementia, bipolar. We also cover acute mental health practice, child and adolescent mental health practice as well. So, you know, that is very much spiraled up as well in our understanding. We also cover a module on professional, ethical and legal challenges in nursing. So that's my module, and it's a fantastic module because you get an opportunity to really debate ethics and professionalism and healthcare and the law, and how that impacts on nursing practice. We also cover the management of complex and long-term conditions. We know that people are living longer, and they're living longer with long-term chronic conditions, so we will prepare you to be able to care for those people. We also have a pharmacology module. This is introduced in year 3. It's a workbook, it's a module that you work through and you complete it in year 4. And what that pharmacology module does is it makes you prescriber ready. It doesn't make you a prescriber because you can't become a prescriber until you're a graduate, okay? Until you're actually working as a registered nurse, but it allows you to become prescriber ready, which is really important, okay, and kind of gives you that one step to becoming a nurse prescriber. We cover a holistic assessment and recognition of health and social care needs, and the fundamental knowledge, values and skills for a mental health assessment. Okay, assessment types. We have a variety of assessment types. We have summative assessments, so we have exams, unseen, written exams. We have essays, assignments. We have presentations. That's something that we certainly support you with. We completely recognise that in year 1, a presentation in front of your peers can be a little bit daunting. So it's something that we do support you and prepare you for, so that by year 4, we even have in the leadership module a Dragon's Den situation where you come to us in year 4 and you're confident and you've got some idea about clinical practice or some equipment that you think would really help with clinical practice, and you come to us and you sell that to us, and who knows where it's going to lead to. It might be the most fantastic idea, and it might be something when you graduate that you take further forward. We run seminars as well. We get you to do a public health poster where you pick a public health topic. It could be smoking cessation, obesity, anything that you want to focus on, sexual health, and you can design that poster and present that to us. We also prepare you for employability, so things like mock interviews, how to write your own CV, things like that. And then, of course, in your final year, you will complete your dissertation, which is a 6,000 piece of work. So in all fairness, compared to some dissertations, it's not that lengthy. And it can be either a systematic review, like a literature review of something that you're interested in, or it could be a service improvement project. We also have some formative assessments, which basically means they don't contribute to your final outcome, your final mark, but they inform your learning. So we do lots of things like mock exams to prepare you for the actual summative exams, small interactive group work, peer feedback, and one-to-one tutorial support. So before every assignment, every exam presentation, we will always, as a group, offer you tutorial support and also offer one-to-one tutorial support. Okay, so nursing comes under the School of Healthcare. We work closely with the university's medical school to embed the ethos of a multi-professional team. This unit that you can see on the picture here is based in the Robert Kilpatrick Clinical Skills Building, which is situated within the Leicester Royal Infirmary grounds, but it is actually owned by Leicester University. The unit level 2 that we're on here is what you can see on this picture. So it's a brand new, we only moved in this year in March. It's a brand new clinical skills unit. It features a mock ward. So we've got a mock ward within the unit. We've got mock clinical areas, things like where you may go and prepare drugs or prepare for a clinical procedure. And we also have mental health simulation facilities. So it might be that you're going to visit a patient in their home, you're going to do a community visit, and it's very much a home from home environment. We also have access to the dissection room at the George Davis Centre, which is on campus. So the Robert Kilpatrick building is just down the hill from campus. The George Davis Centre is further up onto campus. we actually have access to the dissection room, which is what the medical school uses. So things like when you do your bioscience course in year 1, you might learn about the anatomy of the heart and how the heart and the lungs work. And then what we would do is we take you down to the dissection room, and you would actually see bodies that have been donated. People have donated them for medical science, and you will actually see some actual lungs and heart. And the students have absolutely loved it, because it really helps to kind of that aha moment when we talk about the heart and then they actually see the heart. So to be fair, there are very limited dissection rooms within the UK universities, so we're really extremely lucky to be able to have that facility. So as you can see here, we've got a clinical ward. We don't just use mannequins. We've got a dummy there. We don't just use mannequins. We use service users. So people that actually are patients, that maybe are just being monitored or have some experience of being a patient. So they bring their experience, and it's actually, you may talk to them, you may perform a relatively straightforward task like taking their blood pressure or something like that. But they can also, the most vital thing is they offer their experience. So they may well be a past patient or a carer of somebody that's a patient. So the level of simulation can be very low fidelity, where you're using, as you can see on this table here, prosthetic limbs, prosthetic body parts. Then we get into kind of the mid fidelity, where we'll be using mannequins that we can alter their physical state. And then high fidelity, we're actually using things that emulate real practice. Just move on to my next slide. So style of learning, 50% clinical, 50% theory. Theory is delivered through blended learning. So we do lectures, seminars, we do some online learning. We don't deliver a majority of online learning, and the majority needs to be face-to-face. We think it's important for us to teach you nursing face-to-face, but we do some online learning and simulation and clinical skills. We also have opportunities for self-directed learning, where we might give you kind of a signpost to a link, something that you can go and learn about, and then maybe bring back to us to tell us what you found. We do interactive quizzes. There's lots and lots of opportunities and different ways for you to learn. 37.5 hours per week taught content. That isn't 37.5 hours in university. It dips and troughs, really, you know, it's peaks and troughs. But in total, whether it's self-directed or online or clinical placement, we expect you to be able to have completed 37.5. You do get an iPad, unique selling point. Medical students and any of the students that are from that study at the School of Healthcare get an iPad, which is some of the students have found really, really useful for note-taking, annotating PowerPoints, bringing into class. A lot easier than bringing a laptop, and they can use it as a resource. Our clinical skills unit was a multi-million-pound investment. We have interactive mannequins and we use actors, and we've got the dissection room, as I said. We do use service and users. We do use students sometimes, student ambassadors to be involved in some of these events. We also use student ambassadors to represent the course in opportunities like open days, interviews as well for prospective students. We also use service users within simulations, OSCEs, which are very small exams where nurses will be watched to complete a very simple task. For example, this week we had first year OSCEs. At one station they washed hands, at the second station they took somebody's blood pressure and pulse, and at the third station they gave out some oral medication tablets to a simulated patient. So we also get service users involved in things like the Dragon's Den when they do presentations. Those service users offer their personal experiences, which is vital. We also offer feedback in clinical practice. It's a two-way process between our relationship between clinical practice, but also those service users will offer that information as well. And we are working towards building capacity with children and young people and diverse groups in the service users that we use. And they also are very much, they sit on our curriculum development committees, the service users, so that we can ensure but how we deliver our curriculum and any changes that we make with our curriculum mirror exactly what our service users need. Okay, so supporting you, okay, we can support you academically, we can support you through your studies, or we can signpost you for support. We can support you personally and pastorally, okay, and that's very much how we see that we will support you whilst you're on this course. There is a head of nursing, which is myself, okay, I'm the programme lead for nursing. We have within the team we have personal tutors as well and subject specialists, okay. It's very much a peer mentoring process, so we can also buddy you up with students from other year groups, and that's something that we've been doing probably for the last 2 years now, and has worked really well, because we often find that they want to know what that year is like. They also want to, the first years especially, want to know what placement's going to be like. It works extremely well. I know some of our buddy groups have developed things like WhatsApp groups or cafes where they just kind of drop in and have a coffee and have a chat together. And there is clinical support in practice. Like I say, we work very closely with our placement partners to make sure that we support you. There's also university support service. You know, we've got the fantastic student union. We've also got learning support, student welfare, accessibility, where if you feel that maybe you're struggling with your learning, you can go and see accessibility. They can offer you support. There's counselling services, wellbeing services, and there's career development as well. So things like when you're ready to start thinking about your career, you can get some support there. Financial support, we've got learning support funds. So if you're eligible, you can get a training grant of up to £5,000 per academic year. A parental support of £2,000 if you have at least one dependent child under 15 or under 17 years if registered with special educational needs. And money back for excess travel and temporary accommodation costs. So whilst you're on practice placement, let's say you live in Leicester and you're placed in Kettering, that's something that we can look at to reimburse your travel costs. And if students do experience financial hardship, we have an exceptional support fund as well. So applying to Leicester, this is what we require. This is what we're looking at, entry criteria. 3 Bs, okay, including a science-based subject. Now you might say to me, what is a science-based subject? Biology, chemistry, physics, or psychology, okay. General studies, critical thinking, so this is at A level, and global perspectives are not accepted, okay. For any of those 3 grades, we won't accept those. So 3 Bs, 1 being a science-based subject, but psychology is included as a science-based subject. We also need you to have, and this is a nursing and midwifery council requirement, GCSE maths and English language and a science subject at grade C or 4, okay. If you studied a BTEC, we want a DDD in an extended diploma in health and social care or health studies or applied science, okay, including medical or forensic streams. May have undertook an access to healthcare course, so healthcare or science-based diploma at level 3. So you will have attained 60 credits overall, including 15 of those 60 in a topic relating to human biology, anatomy and physiology. Okay, and of those 3 credits, those level 3 credits, at least 30 at distinction and 15 at merit. Graduate entry, if you are a previous graduate, honours degree and a relevant subject to 2-1 or international equivalent. T-levels, which we're seeing more of now. So it's a merit and an appropriate relevant subject. And if you are from a background of armed forces, if you're coming from the armed forces, that is something that we can support military leavers or veterans to apply into the School of Allied Healthcare. So it's something you can seek further advice on. Here's our team. Okay, so there's me, Programme Lead for Nursing, Jo Wilcox. To the right of me is Rebecca Mummery. She is an adult trained nurse and also placement lead, so she'll support you when you're on placement. To the right of Rebecca is Hannah Waterhouse. She is our newest member of the team. Hannah has come from a research background and is also a heart failure specialist nurse and a prescriber. Chris Nichol, he is our marketing lead. He is a digital learning lead. Chris is an intensive care nurse. Usually looks after the first years fantastically. We've also got Hannah Richardson to the right of Chris. Hannah's come from a community nursing background, so she tends to focus on chronic care. To the bottom here, child field lecturers, we've got Jenny Senior. Jenny has come from Leicester, from the Trust. She worked with chronic ongoing children's conditions for a long while. And then to the right of Jenny, we've got Jenna Shaw. She is a children's field lecturer as well. And then we've also, in the middle, we've got our administrator. We've actually got two administrators, but there's Hayley there. She's very much central to the course. She will coordinate things like exam timings, results release, uniform requests, timetabling, and all of that. To the right, we've got Raj. Raj is a mental health nurse and currently our year 1 lead. We've also got Cleo, who is a children's and adolescent mental health nurse. And we've also got Temba, who's a mental health nurse lecturer as well. Okay, so thank you. Okay, thank you for listening this afternoon, this evening, and please do come and join us for some hands-on and simulation fun, hopefully. Any questions?
Wonderful, thank you. We have a few questions that have come in. If you do want to ask a question, please use the Q&A function, but I'll read some of the questions that we have had come through so far. So first question we had was asking what the placements are actually like on a day-to-day.
It depends where you go on placement, really. We have a mix. Some placements will, the community placements, where some students are now, they work very much 9 till 5. So tend to be probably 8:30 till 4:30, Monday to Friday. Some community placements will ask you to work weekends because patients do have community visits at the weekends. That's something that it just depends on where you go. Some nurses are working 12-hour shifts on the wards, 12.5-hour shifts, because that's the shift pattern of the person that they're working alongside. I know that sounds awful, 12.5-hour shifts, but the bonus to that is you only actually end up doing 3 shifts in a 7-day week, because that pretty much you might have to do a very smaller, shorter shift at the end of 4 weeks, but that makes up your full-time hours. And for some students, they really prefer that because then that gives them 4 days to focus on either getting some sleep or doing their assignments. So that's how the placements work. We like you to work alongside your practice assessor, so mirror what clinical hours they're working. We've got students that work nights because that's when their practice assessors are working. We've got students that work weekends. And that is what you will work as a qualified nurse. You will be expected to do the hours as a qualified nurse, but you will be supervised and supported at all times. Okay, any other questions?
Yeah, no, we have a couple more. So one is asking what exactly is a service improvement project?
Anything that you can, I mean, my service improvement project, when I did my master's years ago, was patient discharge. It was something that I was quite passionate about, that we send people home and sometimes they're back within a couple of weeks because we've not identified that actually home wasn't the safest place to be. But it could be absolutely anything. I listened to some Dragon Den ideas the other day and they'd come up with one of them had come up with a glove to stop children pulling out when they have a needle in their hand or they have something on their hand like a bandage and they don't like it because children don't like it and they pick at it and they pull it out, like a fun glove, like a cotton glove, but the children could colour it in before they come in hospital so they could make their own doodles on it in their own hands, and then it fits on like a mitten and it protects it. Absolutely fabulous, because the amount of times that we have to keep reapplying dressings or reapplying a needle, which obviously makes children distressed, it's not good for them, and they're not getting the treatment that they need. If we can do something that will minimise that and also probably add an element of fun, then it makes when children come into hospital maybe not quite as bad as it could be. So it could be from a service improvement level, it could be something that focuses on individuals, so like children. It could be something that focuses on a ward area. Maybe you work on a ward and you think, gosh, this could be done better. Or it could be something where you are looking really broad and you're looking at service improvement from a whole healthcare perspective. Anything else?
Yes, we've got one more question as it stands, but again, if there's any more, please don't hesitate to put them in the Q&A box. The last question is asking about sort of careers after this course. Now, I know obviously there's the main one, which I assume a lot of students would expect, but perhaps you could also tell us about some of the ones which students watching might not necessarily be thinking about that they could go into after this course.
Usually at some point in the course you will decide, if you do the dual registration course, where you feel you sit. Now for some students they will kind of tend to gravitate maybe towards the mental health side or towards the child or the adult side, but what we'd like, if you do go onto the dual registration course, is that you maintain your competence in both fields. So that would be areas like ED, A&E, if you're not familiar with. My first post was in ED here at Leicester, at the Leicester Royal Infirmary. I'm a Leicester graduate, guys, but I'm an adult trained nurse, and there is a real need for dual registration nurses within ED, because we have patients that present with either both or physical and mental health problems, and I'm talking adult and child as well. There's other areas. A dual registration would prepare you really well. In fact, I went to a careers fair, Royal College of Nursing careers fair, that was based in Leicester a few weeks ago, and when I told the prospective employers about our course, they were really, really excited. Things like advanced nurse practitioner. So our course will get you prescriber ready, which means that probably from graduating you can almost be fast tracked to do your nurse prescriber course, which then opens up doorways for you to do advanced practice. So if any of you have come across an advanced nurse practitioner, they work in GP surgeries, they work in urgent care centres, they work on wards, they can prescribe medicines, they can diagnose, they can advocate for treatment, they can recommend treatment for their patients. It's a very autonomous role. You may become an advanced mental health practitioner on the back of this, because this course will equip you not only with the skills to offer diversity of roles, but also the leadership skills for you to be able to fall into those roles that you feel confident and you feel able. So the world's your oyster really with this course, because you it's almost like that extra year of study will not only give you a master's, but it will give you the necessary skills to be able to run with ideas that you have, or maybe challenge practice, or maybe change things for the better. And you will have that critical mind when you go into employability, that you will want to provide high quality care. That will be your mindset by the time you've finished your 4 years, and you will identify when things can be improved. I mean, I'm thinking where our next lot of graduates, they have identified, some of them want to go to work in a prison. Again, the dual registration absolutely fits very well with prison nursing. We have some that want to go into forensic mental health nursing, so the more secure units for mental health nursing. We have some, like I say, that want to go to ED. We have some that want to go and work in intensive care. We have some that want to be more independent roles, so like community mental health practitioners. There's lots and lots of opportunities.
Fantastic. Well, that comes to the last of the questions, so I will leave it over to you to sign off for us all.
Lovely. Well, thank you for listening to me this evening, and hopefully I'll see you in the future. But my kind of last final sign off is, and I know you'll probably think what she will say there, but it is an absolutely fantastic course, because it is so unique. It's brand new, which means we can really make your student experience fantastic. We can place you in lots and lots of opportunities for learning with others. So yes, please do apply, and I hope to see you in the future. Thanks for listening.